The initiative Dementia Needs Competence has been established since 2014 in the Tirol Kliniken Hospital Trust. The Tirol Kliniken is the most diversified healthcare provider in Western Austria. Tirol Kliniken is made up of a range of institutions that form the backbone of medical service provision in Tyrol. All in all, about 8,200 employees work at Tirol Kliniken and take care for 120,000 inpatients. The capacity is 2,400 beds with an average occupancy rate of 80%.
It was no coincidence that we founded the initiative Dementia Needs Competence. The time was right for it. In summary, 4 main reasons led us to implement the initiative. First, disoriented patients need many resources in hospitals. Think about an aggressive patient that causes problems on a ward, or a person with dementia who leaves the infirmary and gets lost. Secondly, we have a public service mandate, and obviously the quality of life of patients with dementia and their relatives was low during hospital stays. Our aim has been since the establishment of the initiative to improve their well-being. A third reason is also connected to well-being. We realized a high work strain of employees that have to take care for patients with dementia. An initiative that gives relief would increase their work satisfaction and most probably increase work efficiency. Last but not least, all demographic prognosis showed that in the future there will be many more very old people and thus also more patients with dementia and a risk for delirium. In order to deal with this trend, to reduce inefficiencies and to increase the quality of life of the patients, the initiative Dementia Needs Competence was established. We recognized that it needs structural changes and not a project that ends at a certain time. Therefore, we organized the initiative as a network consisting of members out of all hospitals of the group and all professional groups. Looking back over the past few years, I can say with pride that we have been able to increase the well-being of patients and employees and have used comparatively little additional financial resources to achieve this result. Most could be done through reallocation of existing budgets.
At the beginning of the initiative, 4 guiding principles were developed. These objectives gave us a common orientation framework for all measures and projects under the initiative. The first principle is sensitize and empower employees. The second principle is recognize potentially affected patients and their individual risks as early as possible. The third principle is patients experience individually adapted interprofessional treatment, care and support. The fourth principle is cooperation and networking internally and externally.
The basis of our activities have been explicitly a hands-on approach. This means to take action and to use the existing knowledge and experience of our in-house experts and specialized departments. We implemented a broad range of activities within the initiative. We would like to give you a rough overview. First of all, employees of the Tirol Kliniken are trained on basic knowledge about dementia and delirium. They should recognize when a patient is affected and act adequately. Moreover, a memory network consisting of memory contact persons, memory nursing and coordinating persons has been established. Within the network, the relevant information flows, projects and patient services are developed. If a challenging situation occurs somewhere at the Tirol Kliniken, the network members are the experts to deal with the situation. The network activities also include external partners such as nursing homes, mobile services and the Dementia Coordination Point for the Tyrol. The network and our core team led to the development of a number of patient-oriented services. Some examples. Very important is the information sheet well prepared for the hospital, which contains for us relevant information on habits and behavior of the patients. This gives us the opportunity to make the hospital stay as comfortable as possible and to avoid behavioral problems and even aggression. Ideally, the information sheet is filled out in advance of the hospital stay by relatives or by nursing homes. Alternatively, the information can be raised within the first days at the ward. Additionally, we established a special patient transport service that knows how to interact with persons affected by dementia. In these cases, the transport service remains with the patients during the examinations or treatments in other hospital units. Furthermore, rooming in of relatives was made possible in special cases. Another service that is generally accepted by our patients is the Relax TV, a TV show that shows well-known pictures from Tirol and is shown for free in lounges and rooms. Activation boxes filled with games, pictures and other helpful tools, well known in this generation, have been made available on each ward. This helps the staff to interact more easily with people with dementia. A developed manual on non-drug care explains employees how to avoid giving sedatives and to keep patients with dementia calm and also active without using drugs. We have a close cooperation with an association that organizes volunteers. This brings in helping hands for leisure activities with the patients. Several volunteers have been trained to accompany patients with dementia. This relieves the staff on the wards and departments. In order to raise the awareness for the topic of dementia, we developed a number of PR activities such as awareness-raising campaigns for employees and events for the public. For example, once a year, a Dementia Day is organized. All in all, we try to stay innovative, creative, and to develop continuously tools and processes that help to increase the well-being of patients and their relatives during their stay in hospital. At the same time, our activities improve the working condition of our employees dealing with patients with dementia.